It's my pleasure to introduce our next speaker, Amy Liepert, who I had the pleasure of training with at the University of Utah, and she represents the academic version of our training, and I represent the community-based version of our training. So she's going to be talking today about leadership opportunities and advocacy at a local, state, and national perspective.
Perfect. Thank you, Kate. Welcome, everyone. Thank you for joining us this evening. I have no disclosures other than a number of positions that I hold at the ACS with advocacy. So I'm going to repeat just a little bit of the prior presenter because I do think it's important to kind of get different perspectives, but you'll see there's a vast amount of overlap. And despite, advocacy being a fairly small field, I haven't had the chance to meet Dr. Sheth before, so I like that we have many of the overlapping principles. So advocacy, the act or process of supporting a cause or proposal, and a number of organizations you can see listed there. Something that is less of an issue today, but something I faced very early in my career as a student, as a resident, is these things of the thought that, physicians and specifically surgeons being involved in advocacy as it being dirty, wrong, corrupt, or for other people to do. And that's, again, thinking of the past. So what then is what I call surgical health policy advocacy, the act or process of supporting a cause or proposal, but specifically focused then on surgical patient populations, the surgical profession, and improving surgical care delivery. How do we keep the surgical patient and the surgical profession at the cornerstone of the purpose of what we do within this realm? So why is this such a challenge? Why do we have to have sessions for this? Why is it a challenge to get these chairs filled with folks? Well, we're trained as physicians and surgeons to be classical scientists, right? We have a well-defined research methodology. We have notions of what reality are, precisions of agent, host, and environmental factors, and we know what it is, right? This is what we've done our entire lives. Well, this advocacy thing seems fluffy and full of politicians that are complaining on TV and all that kind of chaos. It's a dynamic interplay of factors and influences, and it's beyond what we desire for control, and what we like for what we do on a daily basis is control. It seeks to change upstream factors, so things that are generally thought of being out of our control, or things what we do every day, laws, regulations, policies, institutional practices, eyes start to glaze over, prices and standards, influence of personal health choices, what individuals and environments they're in. So my former practice at the University of Wisconsin is very different than the county hospital that I work with at UCSD in downtown San Diego, but brings every single one of these points to play every single day. So I love this quote that I found. For the faint-hearted, advocacy can take on the spectra of fraught, politicized activity, threatening to make our enemies, particularly of retributive government figures and litigious industries. That's kind of the things that comes up. So we want to convince you that that's not the case. How can surgeons then actively engage and lead in the changing face of healthcare? And more importantly, why should we? Patients, most importantly, and the center of patient-centeredness focus that we need to have. Changing reimbursement and environment, we like to not talk about that, but it's incredibly important because without staying on top of that and making sure that we're taken care of as a profession, as surgeons, we won't be there to take care of our patients. And we need to make sure that the institutions of insurance and or other healthcare reimbursement are there so that they can continue to maintain care. Quality and satisfaction reporting is becoming more and more prevalent every single day. And it's important that we follow our passions. We went into surgery not just to run robots, but to take care of patients and to help the communities that we focus in. So I like to look at advocacy as a spectrum, and you heard this from our previous speaker as well. But patient advocacy, which is really what we learned day one of medical school, right? Hippocratic oath. We do this every single day, whether it's getting the right medication for our patients, arguing with insurance companies, arguing with the hospital, figuring out discharge disposition. That is at the core of what we're doing. So it's not what I spend a lot of time talking about because I think it's inherent of who we are as professionals. But when we start talking about local advocacy, state and federal advocacy, this is reaching out of that traditional role and how we actually can impact our patients in these other realms. So what about leadership opportunities then that I was asked to speak about, or maybe assigned myself to a bit? So patient, again, we do this every single day. It's clinical work, it's administration, it's insurance companies. It's expected in our job role. But then local is getting a little bit more outside that. Joining a hospital committee. Your role as a surgeon on a hospital committee has a lot of power and influence. You can do that within the governance council of the academic institution if that's where you're at. You can do it within a legislative affairs office, sometimes called the government relations office. Reach out to those folks. Sometimes they're actual lobbyists that the hospital engages with, or it's someone in the CEO's office or the dean's office. Sometimes they have committees. I was on that at the University of Wisconsin. I met with the dean and CEO on a monthly basis. Fascinating influence and things that came up that were surgical related or they didn't realize were surgical related. We could have an influence and change their opinions. It was great. Within the community, things like the Chamber and the Lions and other community organizations are really important to be engaged with as a surgeon. Those are your patients, and you can have a lot of influence with that and back at your hospital by understanding what is going on in your community. The city council, the school board or PTAs are important. And ultimately, this is where everything rests. All politics, I agree 100%, are local. And so this is where we need to be. And when we talk about grassroots, all grassroots starts locally. So what then is grassroots advocacy? This is just members of the general public contacting their local, state, or federal officials regarding particular use, and this is courtesy of our friend Google. And it's important that this is different than the paid lobbyists. So there's a lot of lobbyists out there talking to our legislators. They are just simply getting paid. There's an important role, but the role that you bring as a community member and as a surgeon particularly is incredibly important and cannot be understated. When we then transition and look at the state and federal, you'll see there's a lot of overlap here. So you want to reach out to your individual legislators' offices, talk to your individual legislators, know who you voted for. It doesn't matter if you voted for them or not. Actually, they represent you, and they will know that you are in their district. They will ask your name and address, and they will keep record of that, and they will keep count of how many times you contact them. That's how you start to develop relationships with them, relationships with their staff, know who their liaisons are, who their health policy liaisons are, and it's okay to talk to a staffer who looks like they're 20 or 25 or maybe even younger. They're the ones who are pushing a lot of the agendas. They're informing the legislator themselves, and they have a lot of influence within that office. So those are great ways to actually make influence. Those are not wasted time or wasted calls ever. This will get you to meet with the member. It's at a certain point as a surgeon, you may be more likely to meet with the member, particularly within the district when they have more time. Fundraisers, all those sorts of activities are great ways to get face-to-face time, and they will look to you like you're very important because you are as a surgeon. Your patients are their constituents, and it's important to remember that. Someone just said this to me in the hallway, and I love when people say this to me, that they just learned that politicians don't actually write any bills. That's absolutely true. So if there's something you want to work on, you work with their staffers, and their staffers write the bill, or maybe you're even going to provide some language for a bill. So it's learning how the game works. The politicians are the politicians, but the work gets done in their offices, and that's true both at the state and federal level. Know that both state and federal, even if you're not in the Capitol or near DC, they all have local district offices, and that's a great staff to know. And then also reach out to their Capitol or district DC offices as well. As far as the state level, looking at organizational chapters, particularly with the American College of Surgeons, join your local chapter, number one. Number two, get on the council. Start pushing an advocacy agenda within the council. You'll make great strides in doing that. Also very important on the state level is engaging in the medical societies. And as surgeons, I think we're kind of taught many times to stay away from the medical societies, but that's wrong. You can have a great amount of influence, and often state medical societies have lobbyists and other resources that you can help engender towards surgical issues that if you're not at the table, that's not going to be done. Engage in the House of Delegates in your state, and then your county societies actually have a lot of influence. And this is a little bit of time. They usually serve you dinner, cocktail or something, so it's also a little bit of fun. On the federal side, you may get more involved at the levels of the American College of Surgeons or at the COT, for instance, or the Committee on Cancer, the AMA, and others. So I'm going to run through this a little bit quickly just for sake of time, but I want to spend a little time with the American College because I spent a lot of time working with them in the Division of Health Policy and Advocacy. Within that, there's a Health Policy Advocacy Council. It's actually chaired currently by a panelist here, Dr. Goldberg. This is grassroots. Anyone can show up. So if you go to the Clinical Congress, there's always the HPAC meeting. Go online to Surgeon's Voice, sign up. There's no screening or anything like that. This is an easy way to be a leader and engage at a national level with the college to join the HPAC. And when you do that, it can lead to other opportunities. The Health Policy Advocacy Group is the executive committee for the division, and it reports directly to the Board of Regents and is appointed by the Board of Regents. Dr. Goldberg and I have both been pleasure of serving on that board for a number of years, and it's a great opportunity that as you build your leadership within particularly particularly the college or other organizations, that you can be elevated to these levels. There's other things like the Legislative Committee and the Surgeons PAC Board of Directors that would also be opportunities for you. So again, here's the grassroots opportunity for you. So what can you do? Attend meetings, build relationships, get your face out there, get your name out there, be personal. You are the expert and the respected advisor to the patients who, again, are the politicians' constituents. Schedule a tour of your hospital. That can get a little bit dicey, so if anyone's interested in that, I'd welcome you to reach out to me, because you do want your hospital on board with that. But politicians love visiting places. They love seeing your trauma center. They love seeing where patients are taken care of. Make sure you're doing the advocacy yourself. Lead by example, right? Engage your colleagues. Have them all come with you. Invite them to different events and activities. And involve your patients if they bring something up. And COVID has allowed such a great opportunity with that, right, to talk about vaccines and things of that sort. So pay attention to opportunities around you. Look at specialty society representative opportunities, such as SAGES reaching out and doing these sessions on advocacy. Again, the college, the AMA are great resources. And if you just say, you know what, I still just don't have enough time, I don't know what to do, I'm not well supported, give some money. If you can't give time, give money. And so the Surgeons PAC, again, this is through the college, but this is the biggest sort of giver for surgeons overall. It's leadership by proxy, and that is still leadership. So how do you lead in advocacy? You participate. You contact your representatives. This is my local California Senator, Ben Hueso. He and I wrote a bill together to put Stop the Bleed kits in every public building next to AEDs in California. And I did that through initially since I'm new to California, a fundraiser opportunity, and then having some other connections and meeting with his staff and meeting with him and finding a collaboration that we're able to do, writing letters to the editor of your local or state paper, being online, making comments. Again, engage your colleagues. This is incredibly important. Write emails, give them easy links to click onto for anything that you're interested in. Send them to Surgeon's Voice, letter campaigns. All of this can be easy. This is the Wisconsin State Capitol and our state advocacy day at the Capitol, and so it's really fun to see a ton of doctors together, and everyone there generally knows who the surgeons are, so it's a great way to reach out as well. So, you know, you can put these things together and have sort of, this is Representative Pocan at the state of Wisconsin. He's a U.S. Congress. He came and toured the University of Wisconsin, and so, you know, you have all these great looking photos that everyone gets all dressed up and with all the fancy people at the hospital. But the real work looks more like this, and so this was just a couple weeks ago before the Senate Appropriations Committee, and we were working with the chair of the Appropriations, who eventually killed our bill, which was very sad, but it's a lot more Zoom meetings these days. It's a lot more meeting between clinics and in between patients, but there's a lot of hard work behind the scenes that go into the big fancy pictures. Real quickly, since I'm over time, I did want to run through our Stop the Bleed example to apply each of these areas of advocacy. So local advocacy with Stop the Bleed, and I think most of you in the room are probably familiar with what Stop the Bleed is, a very easy, simple to apply bleeding control techniques. You know what? Teach your clinic staff. Teach those around you. Make sure your partners are all certified in Stop the Bleed. That's a great example of advocacy by reaching out. Know a little bit of the history. Bleedingcontrol.org gives you all the information you need. In your community, reach out and do community courses. Work with those community organizations. Engage your city or county boards to place Stop the Bleed kits in your public buildings so that they're accessed and it's getting out and speaking about it. That's excellent community advocacy. At the state level, what we tried to do here in California, and we weren't quite successful this year, but we've gotten it farther than we have before, SB 687, we wrote legislation and we adapted old legislation that didn't make it through, and we got it through completely through the Senate and got it all the way through a number of committees in the Assembly, and it got called in California's Appropriations Committee, unfortunately. And then federally, there's a bill out for Stop the Bleed promotion that was introduced. And so you can take one example and put it through all different levels of advocacy leadership. So I hope that's given you all some ideas. I'm happy to take questions at the end. Thank you.